The reason why not having a joint account has worked is because we don't have secrets.
Talking about how wise in men, okay, women go to church and men are not there. You just check when Christianity came to Africa and check when Christianity came to Nigeria, right?
What value do you give to family prayer? If you value family prayer, then you will pray.
Hello and welcome. This is Safe House with Hetty. Safe House with Hetty is a TV talk show that focuses majorly on marriage and relationships. So, if you have a question about marriage and you need to find an answer, worry no more, you are definitely in the right place. My name is Henrietta Okechukwu, your host for the show. Today, we're talking about saving for the sick day. Saving for the sick day. Family health insurance. The National Health Insurance Scheme in Nigeria was officially launched in the year 1999 with the purpose of providing universal coverage. However, due to many flaws over the years, the ability of the system to provide free and good quality health care to the entire population has been greatly limited. For example, artisans, the self-employed, the unemployed have not been substantially covered under the health insurance scheme, leading to poor care access, quackery, self-medication, and preventable deaths. The Nigerian families have had to bear the brunt of this painful reality. Don't go away. We'll be right back.
If you value family prayer, then you will pray.
Welcome back. This is Safe House with Hetty. We're talking about saving for the sick day. National Health Insurance for the family. Today I have wonderful guests on the show. He is a medical doctor, currently working with one of the health maintenance organizations. His name is Dr. Ifediata Nnamdi.
Yes.
You're welcome, sir.
Thank you very much.
And a beautiful nurse and midwife, also working with a HMO. She is Miss Ezudo Ifoma Linda. You're welcome, ma'am.
Thank you very much.
Thank you for coming on the show today.
Thank you very much.
Now, I want to ask you, doctor, what does health insurance mean?
Health insurance is basically, in layman terms, just to make it very simple, is that insurance that you buy to take care of your health, basically, to take care of medical needs. You understand? So bringing down to the family, for example, it's more like saving into a pot, kind of, into a pocket, such that when there are medical needs needed by any member of the family, be it the father, mom, or the children, you can actually tap into that pot to take care of yourself without necessarily putting cost or strain on your personal finances.
Wow.
Yes, that's it simply.
Beautiful. Now, in that family, how many children can one health insurance policy cater for in a family?
It depends basically on what the family actually wants.
Okay.
You see, under the National Health Insurance Scheme, there is actually the social aspect, the one that covers civil servants and so on, and then there's the one that is the private medical insurance. Now, so the social is basically for federal civil servants. Some states have their own for state civil servants and local government workers.
Okay.
Then some private enterprises, some private corporations, they could actually buy for their staff, you understand? Now, but for somebody who maybe works in a place that does not have this kind of coverage or something, you can actually walk to a HMO.
Okay.
Yes,
as an individual.
Yes, as an individual, you can walk to. You can find them on the website. You just Google the HMOs in Nigeria. You can find them. You walk to one, ask them that you want something tailored to you and your family.
Okay.
There's always a premium. That is an amount of money you pay sometimes yearly, sometimes quarterly, and so on, that you make the payment for. That's it basically. And then whatever it is that your amount, the amount of money you pay is covered for, you get that service. Go to the hospital, just get the care without making what we call out-of-pocket payment.
Wow, wonderful, wonderful, very interesting. Now I want to ask you, Ms. Ifeoma, since the inception of the National Health Insurance Scheme in Nigeria, do you have an idea of how many people are actually benefiting from it in this country?
Well, yes, definitely. There is a statistics of the number of masses covered within the National Health Insurance Scheme.
Okay.
And it's quite unfortunate to say that less than quarter of the population of Nigeria,
Less than 25%.
it's not even close to 10%.
Wow.
Yes. As at 2019, one of the newspaper reports stated that it's just about 4% of the population that is covered. And you can't imagine a population that has about 174 million people within to say that it's just about 1 million people that are enrolled, not even 2 million. That's so unfortunate. So a lot of masses are not yet enrolled, and it's not a good news.
Wow.
Yeah.
That is very, very dangerous.
Very poor.
Very
and
poor.
Dangerous.
Very poor.
Yeah.
So that comes back to the fact that only those who are gainfully employed are enrolled.
Exactly.
And out of those who are gainfully employed, only certain cadre of employers can afford to put their staff in a health insurance scheme.
Exactly, yes.
Well, yes.
So who takes care of the artisans, the market women,
Okay.
and all that?
Yeah.
Please, doctor, who takes care of them?
Basically, like she said, it's not even up to 5%. And that 5% is just about the federal civil servants, like I said earlier, some states that have already begun that process, and some local governments.
Yeah.
The rest are kind of like you're almost entirely left on your own as it is, which is unfortunate. But a percentage of the remaining 95 will fall into private enterprises, for example, that have what it takes to cover. Now, as for these artisans, market women, and so on, that's a pool that is left untapped by the health insurance industry in Nigeria. I don't know where to lay the blame actually now. I don't know if it's to lay the blame on ignorance or to lay the blame on the federal government not doing the necessary things, making policies to help cover this kind of people. But that market is huge that has been left untapped.
Now, there are different types of health insurance, right?
Of course.
What type do we have in this country?
Okay. Under the National Health Insurance Scheme, you have basically, to make it more real, the public health insurance scheme and the private health insurance scheme.
Okay, public and private.
Exactly.
Okay.
Now, the NHIS has made it in a way that, just like he said, the social health insurance scheme, which covers the people working under the government parastatals. And then there is another scheme under that, the TSHIP, that's the Tertiary Institution Health Insurance Program. That is for the universities. A lot of universities have inculcated that in their system.
And for the staff or for the students?
For the students.
For the students.
Exactly.
Okay.
So, and also there is this voluntary contribution. This is where NHIS, that's the National Health Insurance Scheme, has made it easier for the other remaining part of the population that are not working with the government parastatals. Okay, so the people walking into the NHIS office and they get themselves enrolled without being employed by the government. So that is another part of it. Then we talk about the private health insurance scheme. For this, the HMO now comes, that's the health maintenance organizations. These are private companies owned by individuals.
Okay.
Okay. Now they are like an intermediate between the National Health Insurance Scheme and then the people, that is the masses.
Okay.
The function of the health maintenance organization here is that, as the National Health Insurance Scheme is, it is like the regulatory body for the private health insurance scheme.
Okay.
Right? So the private health insurance scheme, they adopt or copy, so to say, from the National Health insurance scheme. Okay. Now, in the private health insurance scheme, although majorly a number of their enrollees are from private companies or people, individuals who come together.
Okay.
Yes.
People who come together.
Come together, exactly. Okay. Yes, because most of the private health insurance scheme, you find out that it is difficult for them to enroll individuals. A lot of the private health insurance scheme do not enroll private individuals, although there are some which do it. Okay, so you can, in just a nutshell, say that there are just two forms: the public and the private.
Okay.
Yes.
Very good. So you are telling me that as an individual, I may find it difficult to be accepted into a private health insurance scheme. I'm not working for government.
Exactly.
It may be difficult for me. But you said we can come in a number.
Exactly.
Like, what is the minimum number acceptable?
Now, this varies from companies to companies. I mean, the health maintenance organizations. Okay. Yes. There are some you come to, they tell you a minimum of 10 families.
10 families
come together.
Okay.
Yeah, I think so far that is the least I have seen. Okay. Now, the voluntary contribution under the public health insurance scheme, it's a free will. There is no limitation to it.
Okay.
The only thing that is required from the masses is just to get themselves to the office of the NHIS, enroll themselves. But under the voluntary contribution, the only limitation is that the families have to register per head, and not as if it is for the social scheme where the person who is employed by the government enrolls the family members, that's the spouse, and about 4 children. It's just 4 children. It's just 4 kids.
What if I have 6 children?
Yes, if you have 6 children, what it means is that you just have to get the first 4 enrolled under your own plan, and then have to pay privately. That is the voluntary contribution for the remaining 2. Wow. And then, not as if the 4 will remain permanently covered under the scheme. At the age of 18, they are automatically taken out of the system. Now you have to re-register them
as individuals.
As individuals. That it means.
We'll go for a short break now. When we come back, we'll talk more about that. Don't go away. We'll be right back.
The family is the heartbeat of the world. It is made up of the husband, wife, and children. The society, in turn, is made up of families. Countries are made up of societies, while the world is made up of countries. Little wonder someone has said, if you destroy the family, you destroy the society.
The Bible says, if a man finds a wife, he finds a good thing, and the Lord grants him favor.
Welcome back. This is Safe House with Hetty. We're talking about saving for the sick day, family health insurance. And we have Dr. Ife Diata and Nurse Ifoma. They're talking a lot. Please listen. Thank you. So now you're talking about the family who has to pay 20,000 for. So a husband and a wife, 20,000, and then the 2 children, 20,000. That's 80,000 in 1 year.
Let me not leave that impression with the viewers. Okay. I just want to let you know that that's actually like, it's almost like it will not go beyond that.
Okay.
What it means is that you can walk up to the voluntary contribution aspect of the public sector and say, this is what I want for my family. It's usually permutated.
Okay.
So you can actually reduce the cost. Yes, there are different costs for the voluntary aspect.
Now I want to ask you, what if after paying that amount we don't get sick?
Oh, a lot of people ask me that question when we want to discuss on the private side.
Okay.
Now, let us go back to the private side a little bit.
Okay.
Now, on the private side, you can, like I said, walk up to any of the health maintenance organizations. All you just need to do is Google them up, and then you walk to their office, and then you ask them to create a tailor-made plan for you and your family. Okay? You can do that. If that's just one option. The other option is to come together as a group, cooperatives, societies in the church, You understand? Like the Catholic Men Organization, the Catholic Women Organization, the youth, you can come together as a group. And then your representatives approach the Health Maintenance Organization, and a plan is tailor-made for you. All right. Now, as to the question again.
Getting sick.
Yes, if you do not get sick
yes.
at all. Some health, it depends on what you are buying.
Okay.
Let me give an example. Some health maintenance organizations will say, if you do not use, if you do not go to hospital in the course of a year, some will give you a percentage of your premium back. Some, not all.
Okay.
Some will give you access to what we call wellness tests, kind of. They say, okay, you've not gone to the hospital for 1 solid year of your cover. All right, go to the hospital. Let's
check you.
be examined and so on and so on, and they foot the bill. Okay. That's actually one of the downsides and benefits to health insurance. On the flip side, ask yourself, if you do not have health insurance, what now happens if you have an emergency?
And there's no money.
And there is no money. Which happens to anybody, no matter how wealthy or well-to-do you are. There will be that time that something just goes wrong. I will give you this example of someone I know who kind of like bought this insurance thing off whim, like, okay, I just want to do it. And then on this day, he's traveling, and then the child just starts to perform some sort of magic and stuff. And on his way, he was called by the wife and everything, and he just told the wife, oh, there's this health insurance, open this drawer, take this ID card, go to this hospital. You will not pay a dime. All you will pay is what it takes you to leave the house and get to the hospital.
Wow.
And that is on the flip side. So when the question comes up, when they say, oh, what if I do not access care in a year, I usually will ask you, what if an emergency blows you away within that year?
Please let me add to this.
Okay, please do.
All right. So if you talk about not getting sick, you wouldn't believe it that, just like he said, taking people kind of not mandating necessarily, but asking people to go for a wellness check. If you take a statistics of the number of people that go for this wellness check, you won't believe that there are underlying illnesses. Yes, and that is what is killing a lot of the masses right now, because a lot of illness do not begin to manifest immediately. They lie there until they are developed. Okay, you just talk about cancer, for example. A lot of people have some kind of lumps that are underlying there, and people neglect it because it's not causing them any pain. It's not giving them any discomfort. And by the time it is discovered, it's already a cancerous cell, or it's even metastasizing, and that is when it begins to disturb them. So we won't talk about not getting sick. For an individual or a family who has kids, 1 or 2 days, an emergency must occur. Even if it's not an emergency, the problem we have with the masses is that we tend to neglect our health a lot.
It's poverty.
It's
a lot of poverty in the country. You can't blame them.
Apart from the poverty, you see someone has maybe like fever. The person assumes that it is just fever. Or you have pain, say on the tummy. Mommy, I have pain here. You tell them, just take Gestid. It's just the usual one. But sometimes the pain doesn't just end with Gestid, or they go to the pharmacy or the chemist shop along the road, So this is just abdominal pain, but it could definitely be beyond the abdominal pain.
Yes.
Sometimes people begin to have some kind of pain. For example, appendicitis, appendix, people call it appendix. She has appendix, So this appendicitis, most times when it begins, it's just pain, People begin to take paracetamol, they will mask the pain. I don't know if most people must have heard they said the appendix ruptured. And it will cause more harm and cost them a lot. Okay, so there is no just downside. You must utilize your payment.
Wonderful, very good. That's why you are here, to enlighten our people on all these things. Now, I want to ask you, as a nurse, what cases have you seen? That's made you really get angry, that people, why don't you have an insurance coverage? Have you ever faced something like that?
Yeah.
Yes, I'm asking, have you had any experience where maybe somebody comes to your hospital and you just got angry? Where have you been all this time?
Exactly.
Please give us that experience.
I will take, for instance, pregnant women. I will use that as a typical example. Pregnancy is a situation where the first pregnancy cannot be linked to a second pregnancy, or you can't just compare the second or the third, and the events are never the same. The first pregnancy can be a safe one, but the second one, you can't determine if it will be a safe one, a second one. And now most times you see a lot of women who may have the challenges, or probably they will now be booked for a cesarean section, or cesarean section becomes an emergency.
Yes.
And in this part of the world, it's cost a lot to do a cesarean section, you know.
Yeah,
and now this person does not have an insurance company. You don't just watch this person die. And if the person is unfortunate to be in a private hospital, the private hospital will not waste their resources on the person to take care. But if this person has had an insurance cover, trust me, that person will not pay a dime to get covered for that cesarean section, although it varies from what the person subscribed for in the private sector.
Thank you very much.
Okay.
Let me just cut you there.
Okay.
Thank you very much. This brings me now to what specific ailments can we say an insurance covers? Can your insurance cover somebody that has paid like 10,000 per annum? Can it cover diabetic treatments? Can it cover asthmatic treatments? Can it cover pregnancies that has to go on through CS?
Okay.
Tell me what's...
The good thing about this health insurance is that for most of the health maintenance organizations, there is no financial limit, at least for the consultations.
Okay.
For the medical consultations, the diagnosis, the investigation.
Okay, beautiful. Hold on there.
Okay.
You are saying that if I'm under an insurance scheme and I need to go to General Hospital, for instance, and I need to see a consultant, because you pay different prices for a GP and a consultant. Are you saying that I don't need to pay at all?
Yeah, exactly.
I
for
just
consultations.
Beautiful.
Wow. No matter the private.
Wow.
Exactly.
No matter the specialty.
I'm telling you, you do not need to pay for consultations. Exactly.
So
at least a proper diagnosis.
No matter the premium.
Exactly.
And
proper diagnosis.
Tests, even the tests.
Yes. Unless for all the basic tests, it is covered. Even for the National Health Insurance Scheme, Madam Hetty, you won't believe it that for this cesarean section we are talking about, people under the NHIS scheme who can access the NHIS approved facilities, at the end of your treatment, they only pay 10%.
Wow.
Yes.
10%?
Exactly. Even the cesarean section, yes, it is still covered. Yes.
So why are people not accessing it? Why do you have less than 5% accessing this insurance scheme?
Let me come in here now. The reason why that is the case is this. Now, you see, Nigeria kind of like, I think we started off on a footing that was not really solid. I think for me, my opinion, please, is that the health insurance stuff for the civil servants, I think it was almost like they used the civil servants to test what the NHIS would look like. Exactly. You understand? Exactly. And then the health maintenance organizations now started to diversify kind of, you understand? Exactly. Yeah. So for people, if you assess, like she said, when you assess any health maintenance organization and book and say something for maybe private plan or whatever, at least, at the very least, a consultation must be done for a diagnosis to be made, for lab investigations and for treatment. You will not even drop a dime.
Wow.
Yeah. You understand? Wow. Now, as you go into the private space proper, depending on how, maybe like this afternoon there was a negotiation in my health maintenance organization, for example, where they are discussing, oh, this group of people are coming together to say, we want this. We are about 200 of us. We want to pay 3,000 naira a year, so give us this. The health maintenance organization draws up that plan, meets hospitals and say, when this kind of people are coming, this is what you give them, and that is it. They are covered.
Beautiful. So are you trying to say it's like an Isuzu thing? Are you trying to say?
Exactly. But
it has an element of Isuzu in it, actually.
Wow. We'll draw the curtain here. Thank you, doctor, for coming.
Thank you very much.
Thank you, Mr. Foreman.
Thank you for having us.
Thank you so much for